Let's go ahead and welcome former PMA New England president and current chair of the board, Dr. Grace Perez-Lirio.
Thank you, Antoinette. I'd like to take a brief moment to thank all my colleagues who are working in healthcare. A heartfelt thank you for all that you do. I'm proud to be in your company. And to the families of frontliners, thank you for sharing your loved ones. This is truly a very challenging and difficult time for everyone. I would also like to give a shout out to my two girls, my two daughters, who worked so hard to make our slides look good. Thank you, Andrea and Adrian. I just had to say that. But by the end of this webinar, we hope to provide a brief overview of epidemics and pandemics and learn about the timeline, epidemiology, critical presentation, diagnosis, and management of COVID-19. As you can imagine, my topic today is about pandemics. The content is lengthy and extensive, and I will try to provide you a brief overview of those events that are more closely related to what we are faced with now. I learned a lot while preparing for this presentation. I hope you all do too. So let's start with definition of terms. An epidemic is a widespread local outbreak of an infectious disease, while a pandemic is a global outbreak or occurrence of an infectious disease. Usually, when you talk about pandemics, it affects multiple continents, and this is what we're faced with right now. We have had about 20 epidemics and pandemics in the past 100 years. Some, if not all of them, changed the course of history. And I would like to name the Spanish flu, 1918, which I will talk more about in a bit, SARS 2003, the H1N1 swine flu in 2009, and the MERS in 2012. SARS-CoV-2, so you'll hear these words SARS-CoV-2 and COVID-19. So SARS-CoV-2 is the virus that was initially introduced as a novel coronavirus 2019 nCoV. So it is the infectious agent that is the cause of this pandemic. COVID-19 is the disease. It stands for Coronavirus Disease 2019, and it is a disease condition that is caused by SARS-CoV-2. So the coronavirus got its name because of its appearance under the microscope. I know you've seen this before many times. It has a halo of spike proteins on their surface that resembles a crown. Viruses are very good at doing one job alone, and that is to replicate. It likes to enter and hijack cells and is very effective in making more copies of itself. And there are hundreds of known coronaviruses out there. You might be surprised to know that there's really a lot of them, but 7 have been found in humans. Of those 7, 4 are commonly spread between humans and cause mild disease. These are viruses that cause the common colds, the upper respiratory tract infections, and viral pneumonia. It is impossible to imagine any person going through a lifetime without running into a coronavirus. And while there is no specific treatment or vaccine, most people recover simply with conservative and supportive care. Yes, there are some who don't do very well, but that is a small denominator compared to the small number compared to the denominator, and is usually associated with underlying diseases or comorbidities or co-infections. So there are 3 new coronaviruses that have crossed over to humans, the SARS, the MERS, and now the SARS-CoV-2. These 3 coronaviruses are known to have natural animal hosts, but have somehow jumped to human hosts, causing mild to very severe infections. So worth mentioning are the 3 coronaviruses that are typically hosted by animals. The SARS, severe acute respiratory syndrome in 2003, and this came from bats and spreads only among very sick people. The virus basically spared healthy individuals, and this infection was first identified in China. It lasted for about 8 months and no reported case since July 2003. The MERS of 2012, Middle East Respiratory Syndrome, is a virus that jumped from camels to people and is not easily spread from person to person. So it was identified in Saudi Arabia, occurred over a span of 5 months from April 2012 to September 2012. The SARS-CoV-2, the severe acute respiratory syndrome coronavirus 2, that's a mouthful, is a novel coronavirus initially introduced as 2009 CoV-2, like I mentioned earlier. It is referred to as novel because it is new to humans. It is thought to have spread from bats and civets to people. And unlike SARS, this causes a relatively mild infection, and as a result, it can be transmitted by asymptomatic people without even knowing it. I put up this slide to show the overall human impact or the impact on lives these 3 coronaviruses have had. SARS happened between November 2002 to July 2003. That's about 8 months. And that there were about 813 deaths in 28 countries. I just wanted to bring it back to the US. In the US, for SARS, there were 154 suspected cases, no deaths. And in the Philippines, there are about 12 suspected cases and 2 deaths. And while we have not found a vaccine for SARS, it has not reemerged since 2003. The MERS virus affected 27 countries, and like other viruses, the MERS was found in healthcare facilities where infection prevention measures were not observed well. There was a report of 3 probable cases in the Philippines and 2 probable cases in the US, but no deaths in either US or the Philippines. So all in all, they had 2,494 cases, 858 deaths in a span of 5 months over 27 countries. So bringing you back to SARS-CoV-2, we have about 3.3 million cases as of last night and 235,000 deaths in over 200 countries. I think 212 countries or 220 countries last I heard. Now, I chose the Spanish flu to serve as our teacher today because I feel that there's a lot to learn from that pandemic experience, not because the viral agents are similar, but because of the exponential growth and massive global impact it has made. The Spanish flu pandemic was considered the deadliest in history, infecting 500 million people, causing 50 million deaths. Of those, 675,000 were in the US and 90,000 in the Philippines. So when you think about it, in the US during that time, the population was about 103 million, and in the Philippines, the population was about 10 million. To put this into perspective, there are about 16 million deaths during World War I, which was from 1914 to 1918. So I just wanted to add this. The Spanish flu did not really originate from Spain. To this day, we do not know where it came from, but the reason why it's called the Spanish flu is because of World War I. During the outbreak, reports were not made public by nations involved in the war, and Spain, who was not a part of the war, reported that flu-related deaths. Thus, they became the focus or epicenter of the pandemic. So unlike other viral infections that affected extremes of age, one unusual aspect of the 1918 flu was that it affected previously healthy and young individuals, mostly World War I military servicemen. And so the spring of 1918, in this picture, Camp Funston, Kansas, there were about 48 servicemen that were infected with flu-like illness. And at the end of that spring, there were about 1,000 flu-like illnesses in servicemen and 40 deaths. Back here in Massachusetts, at Camp Devens, they reported about 21 flu-related deaths during the spring. And as you know, during the war, military personnel were continued to be mobilized to different parts of the world. And there was a second wave that was seen during the Spanish flu in the fall of 1918. This time, it not only affected servicemen, it also infected civilians. So the Philadelphia Liberty Loans Parade was a parade held on September 28, 1918. And this was organized to help the Allied troops during World War I. More than 200,000 Philadelphians attended the parade, which led to one of the largest outbreaks of the Spanish flu in the United States. It has since been declared the deadliest parade in American history, with 10,000 people dead in 10 days. The Philadelphia Public Health Director at that time knew about the sailors from Boston who arrived on a Navy ship who had flu-like illness. At that time, 16 sailors died in 3 days. But despite knowing that, his decision to proceed with the parade was based on patriotism at a time of war. On the other side, St. Louis, Missouri, public gatherings were banned. And although it was not a very popular decision at that time, at the peak of the pandemic, their death rate was about 1/8 of Philadelphia's. So it wasn't until 1933 when the virus was first isolated in the laboratory, and 1938, 20 years later, when the first flu vaccine was introduced and used on military servicemen. This is a picture of Dr. Salk, who is known for his work on tuberculosis. So currently, just so you know, there's about 37% vaccination rate in the US and about 39 to 56 million influenza-like illnesses predicted from October 1, 2019 to April 4, 2020. So that's a big population of people that get affected with the flu, as you can see. So I know some people are not Filipinos, but I just wanted to share this brief history of what Philippines was doing during the Spanish flu. So at that time, the Philippines was an American occupied territory, And there were also two waves of the Spanish flu, June and October of 1918. So it correlates with all those traveling servicemen. But what makes it unique is that the Filipinos quickly named it the trancazo, suggesting that it was an illness that originated from the Philippines. But there was really a concentration of cases among people who worked at Manila's ports, where all these servicemen were arriving. So we thought that it was imported. But the Filipinos did really just embrace the trancazo as its own. And in the meantime, these servicemen continued to train Filipino officers in centers, such that military training camps became a cesspool for the spread of infection. Like I said earlier, about 70 to 90,000 estimated deaths by the end of the Spanish flu in the Philippines. So fast forward to 100 years later, here we are today, the COVID-19 pandemic. It was hard not to include many other significant events that led to where we are right now, but I picked these dates that I think are important to give us a sense of a good timeline. I base this off the World Health Organization, CDC, and mass.gov. So November 17 was the first possible case of an individual with an unusual kind of flu-like illness in Wuhan, China. December, when the Chinese government started to track these cases, over a month later, and that by December 31st, China reported this to the World Health Organization. On January 4, laboratory in Wuhan detected coronavirus, which they identified was similar but not the same as SARS in 2003. January 7, the pathogen was named as novel coronavirus or 2019 nCoV, and this was in China. And January 16, back here in the Philippines, we have an alert of a possible novel coronavirus case in Boston from a confirmed traveler who came from Wuhan. We didn't have tests then, so it took about a couple of weeks before we could confirm this. But the first confirmed case in the US was actually in Washington State on January 21st. On January 23, China had started their 11-week lockdown. And mind you, January 25 was the Chinese New Year, and all those celebrations were canceled. On January 30, the first confirmed case was detected in the Philippines, and a travel ban was issued for those entering the Philippines. On February 11, the World Health Organization announced SARS-CoV-2 as the name of the new virus and COVID-19 as a disease. On March 10, a state of emergency was declared in Massachusetts. It's not the same as lockdown. And a containment zone was identified in New Rochelle, New York at the same time. On March 11, finally, the World Health Organization declared COVID-19 as a pandemic after over 110 countries reported their cases of SARS-CoV-2. On March 17, a home quarantine was ordered in the Philippines. And May 2, here back in Boston, here we are on our 8th week of the pandemic, at least from the state of emergency was issued in Massachusetts. So while none of us have lived long enough to experience what it was like during the Spanish flu, I do think that with the advances in science and technology, we can expect better outcomes as long as we adhere to the general guidelines set forth by our local public health officials. We also need to understand the nature of viruses, specifically new diseases, and the lengthy process involved in research, drug, and vaccine development. And while it took 20 years to come up with a flu vaccine and still 17 years without one for SARS, I do believe that we are closer to getting more definitive answers now than we were 8 weeks ago. May 18 is set to be a possible partial reopening. That will be our 10th week. I will pause here.